Welcome to the University of Colorado Hospital presentation on post-transplant medications. What you need to know about your new medications. Through this presentation, we hope to empower you with knowledge in order to avoid drug-related complications, gain a basic understanding of how anti-rejection medications work, identify potential side effects of your new medications, and understand when to call your transplant coordinator. We will begin with Immunology 101, a brief explanation of how your new medications work. We will then review the most commonly used medications, including their dosage, monitoring, and potential side effects. We will cover antibiotics and antiviral medications, when you should contact your coordinator, and finally, review some medication tips and frequently asked questions. Immunology 101. You will need several drugs to work together in order to decrease your risk of rejecting your new organ. Your immune system has circulating spy cells that constantly work to serve as sensors for foreign bodies. If something foreign is found, these spy cells trigger a cascade of events in an attempt to rid your body of the invader. Examples of these invaders in a healthy person would be bacteria or viruses. Unfortunately, these spy cells cannot distinguish between a good new organ and bad bacteria. Because of this, these spy cells will never accept your new organ, and they will mount an immune attack if given the opportunity. There are several steps in the rejection process, which is also known as the rejection signal cascade. First, spy cells find your new organ and sense that it is foreign. They then migrate to lymph nodes and spleen to tell the leader T cells about the discovery. The T cells are then activated and communicate to their army cells to multiply and recruit other killer cells. These cells multiply about 10,000-fold and attack the organ. This process can lead to rejection of your new organ. Your new medications will help tone down the body's ongoing attempt to destroy the foreign organ by decreasing your immune response. Combinations of multiple anti-rejection medications, also known as immunosuppressants, are used to intercept the attack signal at different points in the pathway. Because each of these medications work differently, it is important to take them on schedule to properly block the signals. By taking your medication correctly and on schedule, you will help decrease your risk of rejection. After the transplant, most patients are started on 2 to 3 anti-rejection medications, one from each blue box. Prednisone blocks the first signal from the spy cell to the T leader cells. Tacrolimus or cyclosporin is used to block the second signal, also known as IL-2 activation, but may be replaced by sirolimus or everolimus in certain circumstances. Finally, mycophenolate or azathioprine will be used to stop the army cells from multiplying. We will discuss each of these drugs more in depth later in the presentation. Anti-rejection medications may also be called immunosuppressants. A combination of medications is utilized for maximum signal blocking and generally includes tacrolimus, cyclosporin, or less frequently sirolimus. The combination will also include mycophenolate or azathioprine and prednisone. The type of organ transplant you received and other factors that are specific to you will determine your exact regimen. While taking these anti-rejection drugs, we will be working very hard to strike a balance between rejection and infection. As a result of immunosuppression medications, your body will not be able to mount as strong of a response to fight off true invaders such as bacteria. This means you may be at an increased risk of infection. Your doctor may prescribe antibiotics and/or antiviral medications as a preventative measure against infections. An example of an antibiotic that may be prescribed is Bactrim. Valsite is a common antiviral. Your new anti-rejection medications will consist of mycophenolate, also known as Cellcept or Myfortic, tacrolimus, also known as Prograf, and prednisone. To refresh, our goals of immunosuppression are to prevent rejection and new organ loss, minimize side effects and drug toxicity, and provide cost-effective therapy. The first drug we will discuss is mycophenolate, which is also known as Cellcept or Myfortic. Mycophenolate acts in the last step of the rejection cascade by blocking the ability of T cells to multiply and attack the new organ. This medication is usually taken as 2 tablets by mouth every 12 hours. Mycophenolate is generally well tolerated by transplant patients, but some patients may experience side effects of nausea, vomiting, and/or diarrhea. Occasionally, mycophenolate works too well and decreases the number of white blood cells, or your immune cells, below a level we are targeting or are comfortable with. Low levels of white blood cells may cause an increased risk of infection. This is why we monitor your white blood cells in your blood work. We may change your dose based on the findings in your blood work. The next anti-rejection medication we will address is tacrolimus, also known as Prograf. Tacrolimus works by decreasing the signal from the T leader cells to the killer cells, or army cells. If the army does not hear the signal to recruit and multiply, it will not be able to attack your new organ. You may take tacrolimus with or without food. However, to keep your blood levels stable, we ask that you be consistent. Therefore, if you take tacrolimus with a meal or snack, do so every time you take the drug. Your exact drug dose is specific to you, but you should always take it twice daily on a regular schedule. We will be checking the levels of this drug in your blood in order to adjust the dose to a target level for your specific needs. Common side effects of tacrolimus include tremors in the hands and feet and headaches. If you experience these, contact your coordinator. Do not wait to see if they go away on their own. Tacrolimus may also increase your blood sugar, which may be something you should monitor closely, especially if you have diabetes. Additionally, long-term use of this drug may lead to an increased risk of kidney damage. This occurs through a decreased blood flow into the kidney. NSAIDs, painkillers like ibuprofen, aspirin, and naproxen, also decrease blood flow into the kidney, so do not take these drugs. It may lead to kidney failure. Your kidney function will be monitored in your blood work, and your dose may be adjusted if we notice changes. You will be following up with us frequently as an outpatient. Here are some instructions for the days you visit the clinic for blood work. Please do not take your morning medications as scheduled. Instead, bring all of your medications with you. You will take your morning dose after we draw blood. Taking your medication before the blood draw will provide an elevated level, which is difficult for us to interpret. By waiting until after we draw blood to take your medications, it will make it easier for us to manage any dose changes. Goal tacrolimus drug levels vary based on several factors, such as time since transplant, age, and ethnicity. Initially, we will be looking to target blood levels of tacrolimus between 5 and 10 nanograms per milliliter for optimum immunosuppression balanced with minimal side effects. If the blood level is too low, below 5 nanograms per milliliter, your risk for rejection may increase, so we may increase the dose. On the other hand, if the blood level is too high, above 10 nanograms per milliliter, you may be at risk for side effects, leading to a decrease in dose. Tacrolimus is processed in your liver by an enzyme called CYP450-3A4. Unfortunately, roughly 50% of all medications use this same enzyme to be processed. This can lead to drug interactions. Competition for this enzyme may lead to increased blood levels of tacrolimus and side effects. Therefore, it is extremely important that you contact your coordinator prior to starting any new medications. This includes over-the-counter, herbal products and supplements, and any prescriptions, even ones that are prescribed by a different physician. If you are given or would like to start a new drug, call your coordinator immediately to be sure that there will not be any problems with your other medications. In addition to drug interactions, grapefruit juice has been shown to use the CYP450-3A4 system and may alter drug levels. Therefore, you should avoid grapefruit and grapefruit juice altogether. The final drug we will discuss is prednisone. Prednisone acts as a catch-all for any pathways missed by the other drugs. It works in several different ways, but the most important is by decreasing communication from the spy cells to the leader cells in the initial step of the signal cascade. Decreasing the chance of the leader cells hearing the communication from the spy cells after they find a foreign organ can help decrease the risk of rejection. Prednisone dosing is slightly different from the dosing of your other drugs. Immediately after transplant, you will receive high-dose steroids. These will be given in an IV form similar to prednisone called methylprednisolone or solumedrol. Once you are home, our goal will be to slowly taper your oral prednisone dose in order to minimize unwanted side effects. Prednisone is typically taken once daily, usually with breakfast. Prednisone and other steroids are often associated with several side effects. These affect all patients differently and with different severities. You may respond differently from a peer who is receiving the same dose. Commonly reported side effects include long-term decreased bone density, which your doctor may combat by prescribing a calcium supplement, jittery feelings or insomnia, which you can combat by taking your medication in the morning, nausea and GI upset, which you may combat by taking your dose with food, and increased blood sugar. You may want to monitor this closely, especially if you have diabetes. All immunosuppressants may increase your risk of certain cancers. This is because the immune system is no longer as good at recognizing bad cells and removing them. To help protect yourself against skin cancer, avoid prolonged sun exposure, wear long sleeves and a hat, and apply at least SPF 50 sunscreen when outdoors. To help protect yourself against lung cancer, do not smoke and minimize exposure to secondhand smoke. Smoking cessation programs are available if needed. It is important to discuss the risks of pregnancy while taking these medications. All immunosuppressants can cross the placenta and enter the fetus. Knowledge is limited regarding the extent to fetal exposure and consequences of immunosuppressant use during pregnancy. Therefore, dual forms of contraception should be used while on these medications. If you or your partner is of childbearing age, it is important to discuss family planning with your doctor. Next, we will discuss antibiotics and antiviral medications. Your doctor may prescribe a course of medications to help prevent infections after your transplant. This will be based on tests performed on you and your donor organ. If prescribed, patients typically take these medications for several months. This is to ensure that the underlying infection is completely suppressed or treated. Bactrim is an antibiotic that helps decrease the risk of certain bacterial infections, like pneumonia, while Valsite is an antiviral that helps decrease the risk of certain viral infections. Never hesitate to call your coordinator if you have any concerns or seem to be experiencing any problems. We encourage you to call your coordinator if you have a fever, a temperature above 100 degrees Fahrenheit, if you are experiencing any organ pain, either from the donated organ or on the surface of your body, if you are having diarrhea, have missed a dose of medication, if you have received a prescription for a new medication, or if you would like to take an over-the-counter product. Remember, it is better to be cautious. Do not wait to see if problems go away on their own or try to tough it out until a more convenient time to call. We will finish our presentation with some helpful tips and frequently asked questions. When refilling your prescription, contact your pharmacy a few days before you need to pick up your medications. Some pharmacies may need a day or two to make sure they have the correct medications on hand. Look at your pills. Know their shape, color, and the markings on them. Mistakes can happen, and you want to be able to recognize them before taking the wrong dose or drug. Finally, when traveling, always pack a few extra days of medications. Delays can happen, and the local pharmacies may not have the right medications in stock. What should you do if you miss a dose? We hope that you take advantage of your new transplant and are active. We understand that distractions can happen and it is easy to forget to take a dose of your medications. If it has been less than 4 hours since you were supposed to take your medication, go ahead and take it. If it has been more than 4 hours since you were supposed to take your medication, skip that dose. You should take your next dose as scheduled. For example, if you miss your morning dose, take the evening dose as you regularly would. Do not double up on your pills. Contact your coordinator so we have a record of a missed dose. That way we can account for any changes that we find at your next blood level check. You may be continuing medications that you were taking prior to your transplant, and you may be stopping some. When you leave the hospital, your doctor will tell you and your coordinator which medications should be continued or stopped. If you have any questions about your medications once you are home, please contact your transplant coordinator for clarification. Because of the potential drug interactions, we want you to call your coordinator when taking new prescriptions. However, if you need a painkiller and cannot get a hold of anyone, you may take acetaminophen or Tylenol, no more than 3 grams per day. Your doctor will also be able to prescribe more potent painkillers if you are not able to control your surgery pain with over-the-counter medications alone. It is critical that you do not take NSAIDs such as ibuprofen, Advil, Motrin, naproxen, or Aleve, as they may cause kidney failure when combined with your current medication. We also discourage consuming alcohol. If you do decide to have a drink, limit your intake to no more than 1/2 glass per day. Please note, this is not additive. You may not skip a few days and then have multiple glasses of alcohol. We also encourage you to avoid grapefruit and grapefruit juice and any medications or products that have not been called into your coordinator and approved. To conclude, we are aware that this is a lot of information to receive at once. We have a few take-home points for you. Remember that immunosuppression is a balancing act based on many donor and recipient factors. Too little immunosuppression leads to an increased risk of organ rejection, whereas too much immunosuppression may lead to an increased risk of side effects and infection. Your new medications will be started before you are discharged, with frequent monitoring in the weeks to come. You may experience dosage or medication changes in the upcoming months if necessary. If you experience changes or side effects, even ones that are not listed here, please contact your coordinator. Your transplant coordinator is your advocate and a valuable resource. They are available 24 hours a day, 7 days a week to help you. When in doubt, make the call, anytime, day or night. If you have further questions, let your nurse know that you would like to speak with your transplant pharmacist. We would be happy to stop by and address any questions or concerns that you may have. Congratulations on your new transplant. Thank you for watching this presentation. Please take a moment to fill out our survey, which will better help us educate our patients on their new medications.